This is the picture that shows how prone position works and improves hypoxemia. If you see, this is the, if you look at number C, this is the patient in supine position, and number D, this is the patient in prone position. The light colored area is well ventilated area, and the dark color is poorly ventilated area. If you compare these two pictures, the C and D, you will notice that in prone positioning, the well ventilated area is much more than the in the patient with supine position. So it clearly improves the hypoxemia while the patient is in prone positioning. So these three strategies: low volume, low pressure strategy, paralyzing the patient, and prone positioning. These three strategies should be followed. It is very important for ICU patients. So this is the last resort. This is extracorporeal membrane oxygenation. This is basically bridging therapy for lung recovery. What happens that you have to divert the blood from the body and pass through an external machine which acts as a lung. Oxygen is added to the blood, carbon dioxide is removed from the blood, and then blood is redirected through a large vein back into the body, so bypassing the lungs. This improves the, this is basically like lung dialysis. Okay, then fluid management, conservative fluid management should be done. That is, don't overhydrate the patient, don't give extra fluids. It can be monitored by keeping the CVP between 4 to 8 mm of Hg. Fluid management strategies include use of IV crystallite, vasopressors, ionotropes, and diuretics to maintain effective tissue perfusion and output. Other supportive care should also be done, like nutrition, because it is a hypermetabolic state. It can be done through NG and parenteral as per raised caloric demands. Then lastly, prophylaxis of expected medical complication, for example, deep venous thrombosis and stress ulcers. Give prophylactic dose heparin, and for stress ulcers give EPIs. Now, it's a list of some drugs which has been trialed against COVID-19. There is no specific treatment, approved antiviral treatment currently for COVID-19 infection. Several existing antiviral drugs have been trialed, but there is limited clinical experience regarding these drugs. Lopinavir, ritonavir has been FDA approved for HIV, is widely available throughout the world, has been tried in SARS and MERS. With interferon alpha, it has been tried in COVID-19, but the results are not promising. Chloroquine and its derivatives has been used in China, South Korea, and many countries, and it has shown some promising results, and further trials are underway. Azithromycin in combination with hydroxychloroquine is also used in some protocols. However, the risk of cardiac arrhythmias must be considered. Remdesivir is an experimental antiviral agent. Basically, it is a nucleotide analog. It has shown significant activity against coronaviruses. Then immunomodulators such as tocilizumab, which is monoclonal antibody against interleukin-6 receptors, has also been investigated in COVID-19. Convalescent plasma, which is plasma recovered from a recovered patient, COVID-19 patient, has been also trialed and shown promising results, but trials are awaited. Ivermectin, which is an anti-helminthic drug, has shown activity against SARS-CoV-2 and is under trial. There is also other drugs like favipiravir, which has also been used with limited benefit. That's all. Thank you. May Allah protect us and heal us all. Thank you.
Thank you very much, Dr. Himayatullah, for this nice presentation about the management of acute respiratory failure in ICU setting. There is, Doctor, just before you leave, there is some questions and interesting questions about your topic. So they're asking about the fecal-oral transmission. Is there any evidence about that? Because we know that it's the coronavirus now. It's appear in the stool. So is there any evidence or published data about that? There is fecal-oral transmission?
Yes. Yes, there is some cases reported through orophycal transmission, but since there is a new disease and many things are under experiment and many things are under observation, many things are hidden yet, but there are cases which have been reported through orophycal transmission, though it is rare.
Mm-hmm. Okay. And there is one more question, which is about chest physiotherapy. Why should we avoid? What should be avoided?
Chest physiotherapy. Basically, chest physiotherapy is an aerosol-producing procedure. What it does that it causes spread of the infection. It will cause aerosol production, and it will spread SARS-CoV-2. So all these procedures like sputum induction, like chest physiotherapy, like CPAP, BiPAP, these all produce aerosol and can cause spread of the infection. So these should be avoided.
Okay. Thank you very much, Doctor. And there is some questions for Dr. Ali, if he can just joining us now. And if you can switch, Dr. Himayatullah, and stop sharing the presentation. Stop. The presentation is already off. But if you can switch, Dr. Shabir and Dr. Ali.
Yes.
There is some questions about the dispose of how to dispose the PPE and lab samples here in Saudi Arabia. Is there any rules or any things how to deal with these things?
Yes, sure. The Command and Control Center just published the guideline for healthcare professional. This guideline just discuss the medical waste in general, and just give us as a referral to GCC Infection Control Prevention and Control Manual. This is the third edition of this manual, how to deal with every medical waste, even in the ward or in the lab or everywhere. So we can just refer to just this manual, third edition, in more than 200 pages, just to discuss this issue, medical waste